Let me ask you something that I genuinely want you to think about. Right now, somewhere in your kitchen, probably in the cabinet above your stove or on a shelf in your pantry, there is something you've been eating for years, maybe decades. Something your mother probably gave you. Something that's been on every shopping list you've ever written. And what I'm about to tell you today is that for people over the age of 55, that one thing could be quietly, invisibly, destroying a pair of organs that never complain, never warn you, and by the time they finally speak up, the damage is already done. Decades of preventative medicine research reveal a heartbreaking pattern. Doctors across the world see it every single day. Wonderful people, grandparents, retirees, people full of life who are completely shocked when they finally look at their lab results. Absolutely blindsided because nothing hurt. Nothing seemed wrong until suddenly everything was. Today, I'm going to show you exactly what the clinical data tells us. And I'm going to do it in plain language, because you deserve the truth, not a textbook. Stay with me, because what I'm about to share in the next 20 minutes may be the most important health conversation you watch all year. I am Dr. Arthur Clark, and if you're here for the first time, this channel is about one thing: giving you the real, clear, science-backed information that your doctor wishes there was more time to tell you in a standard 10-minute appointment. But before we dive in, quick question for the comment section. What city or country are you watching from right now? I read every single comment, and I love knowing who is in this community with me. All right, let's get into it. The organ nobody thinks about until it's too late. Before I reveal what's hiding in your kitchen, I need to make sure you understand why your kidneys are worth protecting so fiercely in the first place. Because here's what I find fascinating, and a little heartbreaking, and about human nature. We worry about our hearts. We check our blood pressure. We get our cholesterol tested. But the kidneys, they're the forgotten heroes of the body. And most people don't give them a single thought until they're already in trouble. Let me paint you a picture. Imagine you hired the world's most efficient cleaning crew to work inside your home 24 hours a day, 7 days a week, no holidays, no sick days. This crew filters through approximately 200 liters of blood every single day, pulling out waste, toxins, and excess fluid. They regulate your blood pressure, balance your electrolytes, activate vitamin D to protect your bones, and signal your body to produce enough red blood cells so you don't feel exhausted all the time. That's your kidneys. Now, here's what makes them both incredible and terrifying. They do all of this in almost complete silence. They don't have nerve endings that send sharp pain signals the way your back or your knees do. They can lose up to 60 or even 70% of their function. And you might feel fine, tired maybe, a little more swollen in the ankles, slightly foggy, but nothing that screams emergency. That silence is the trap. And this is especially critical for those of us over 55, because here's something that doesn't get discussed enough. Kidney function naturally begins a slow, gradual decline, starting around your 30s. By the time you're in your 60s or 70s, your kidneys may already be operating at a reduced capacity. And that means they have a much smaller margin of error when you expose them to things that harm them. Think of it like this. When you're young, you have a full tank of gas. You can afford to waste some. But when you're older, and that tank is already half full, every drop matters. Every choice matters. So, what's draining that tank? That's exactly what we're here to talk about. I'm going to walk you through what I believe is a hierarchy of hidden kidney threats, building up to the one I call the silent architect of kidney disease, the one that's almost certainly in your kitchen right now. Let's start from the outside and work our way in. Threat number 4, the pill you trust too much. Here's a scenario I want you to recognize. Your knee has been aching, or your lower back. Maybe it's arthritis that flares up in cold weather. So, you do what millions of people do. You reach into the medicine cabinet, pull out a little orange bottle, and take 1 or 2. Maybe you've been doing this every single day for months. And why not? It's over the counter. The pharmacist didn't ask any questions. It says right on the label, it's safe for adults. Here's what the label doesn't tell you. I'm talking about non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, some of the most commonly used medications on Earth. And in older adults who use them regularly, they represent one of the most underappreciated threats to kidney health I see in my practice. Here's the mechanism in plain English. Inside your kidneys, there are tiny blood vessels, microscopic tubes, that are kept open and healthy by signaling molecules called prostaglandins. These prostaglandins are like a traffic controller, keeping blood flow moving smoothly through your kidney's filtration system. NSAIDs work by blocking prostaglandins throughout the body to reduce inflammation and pain. It works beautifully for that purpose. The problem? They block prostaglandins in your kidneys too. And when that happens, those tiny vessels constrict. Blood flow drops. The filters, called nephrons, start running on low oxygen, like a city experiencing a rolling blackout. Take one pill after a hard day and your kidneys recover. But do this daily for weeks, months, or years. Those blackouts accumulate. Scar tissue forms, and nephrons, once destroyed, do not regenerate. They are gone forever. The people most at risk are older adults, people with even mildly reduced kidney function, anyone with high blood pressure or diabetes, and anyone taking blood pressure medications because certain combinations amplify the damage dramatically. What's the smarter path? First, talk to your doctor before taking these medications regularly. Ask about your kidney function numbers, specifically your GFR, glomerular filtration rate. Know your baseline. Second, explore alternatives for chronic pain. Physical therapy, targeted exercise, heat and cold therapy, and in some cases, acetaminophen taken correctly can be a gentler option for the kidneys. Third, and I say this with full understanding of how real chronic pain is, never let pain management become a silent kidney management problem. One problem solved by creating another is not a solution. If you're still here with me and finding this helpful, take a moment to type 4 in the comments. It lets me know you're watching and getting value from this. Threat number 3, the dehydration you don't feel. Now, this one surprises people every single time I bring it up. As we age, one of the most significant but least discussed changes in the body is this. Your thirst mechanism becomes less reliable. In younger people, when the body needs water, the brain sends a clear, unmistakable signal. You feel thirsty, you drink, balance restored. But by the time we reach our 60s and 70s, that signal gets quieter, delayed. Sometimes it doesn't show up at all until you're already significantly dehydrated. And here's why this is a kidney emergency hiding in plain sight. Your kidneys need a constant, steady river of fluid to do their job. When you're dehydrated, even mildly, chronically dehydrated, that river slows to a trickle. The concentration of waste products in the blood rises. The kidneys have to work harder to filter less fluid. The urine becomes more concentrated, which raises the risk of one of the most common and painful kidney problems in older adults, kidney stones. But it goes deeper than stones. Chronic, mild dehydration keeps the kidneys under a persistent, low-level stress. Over years, this stress contributes to a gradual erosion of kidney function that shows up in lab results years later with no single identifiable cause, just time and too many days of not enough water. Here's my practical prescription for this one. Stop waiting to feel thirsty. If you're thirsty, you're already behind. Instead, build hydration into your routine, rather than relying on the sensation. A glass of water first thing in the morning before coffee. A glass with every meal. One mid-morning, one mid-afternoon. Check your urine. It should be a pale straw yellow. If it's darker, your body is telling you something. And one thing I want you to remember, coffee, tea, sugary drinks, and alcohol are not substitutes for water. Some actively pull fluid out of the body. When we talk about hydration, we mean water. Plain, simple, non-negotiable water. This one is free. It's easy, and it may be the simplest thing you can do today to start protecting your kidneys. Don't underestimate it. Threat number 2, the protein trap. Now, here's where it gets really interesting, and this is the threat that causes the most confusion, because it's wrapped in something that sounds healthy. You've heard your whole life that protein is good for you. Strong muscles, better recovery, more energy. And yes, protein is essential, especially for older adults who are battling the muscle loss that comes with aging, what we call sarcopenia. But here's what the wellness world doesn't tell you with enough emphasis. High protein consumption, especially from certain sources, especially in large, unregulated amounts, forces the kidneys to work significantly harder. Let me explain why. When your body breaks down protein, it produces nitrogen-containing waste products. The primary one is something called urea. Your kidneys are responsible for filtering urea out of the blood and excreting it in urine. More protein consumed equals more urea produced, equals more filtration work for the kidneys. In a young, healthy person with fully functioning kidneys, this isn't necessarily a crisis. But in older adults, remember what we said about reduced kidney capacity with age, or in anyone with already compromised kidney function. Flooding the system with excessive protein is like asking an overworked filtration plant to handle double the volume with half the staff. The research is clear enough that even conservative medical guidelines recommend that people with chronic kidney disease significantly reduce protein intake. But here's the twist that catches people off guard. This doesn't mean you should avoid protein. It means you need to be thoughtful about the type of protein and the amount. Plant-based proteins, from beans, lentils, tofu, are generally processed more gently by the kidneys than large daily servings of red meat or ultra-concentrated protein powders. And the protein powder market, now booming in popularity, even among older adults who want to maintain muscle, that's an area where I often see people unknowingly creating strain. No one needs 200 grams of protein a day. Work with your doctor to find what's appropriate for your body weight and kidney function. Get tested. Know your numbers. And if you love your protein shake, make sure it's not the only conversation you're having about your kidneys. Before we get started, tell me your name and where you're watching from. I read every comment, and I'd love to know who I'm helping today. Threat number 1, the hidden kitchen killer. All right, we've talked about painkillers, dehydration, and protein excess. All real, all serious. But now I want to talk to you about the one thing I consider the most widespread, most overlooked, and most insidious kidney threat of them all. And here's what makes it so maddening. It's hiding behind a health halo. It's masquerading as something nutritious. It shows up on labels next to words like natural, organic, heart healthy, and clean. I'm talking about excessive dietary oxalate. Specifically, the kind that comes from certain foods that many health-conscious older adults eat every single day, believing they're doing their bodies a favor. Let me explain what oxalate is, because I can almost guarantee this is not something you've heard explained clearly before. Oxalates are naturally occurring compounds found in plants. Plants produce them as a kind of defense mechanism. Your body also produces small amounts as a byproduct of normal metabolism. Under normal circumstances, most dietary oxalate binds to calcium in the gut, gets escorted out in your stool, and never causes a problem. But when oxalate absorption is too high due to diet, gut microbiome issues, or reduced kidney clearance, it gets absorbed into the bloodstream. And then your kidneys have to deal with it. Here's what happens next. Oxalate in the blood gets filtered into the urine. Inside the kidney's filtration system, oxalate loves to bind to calcium. And when calcium and oxalate combine in the wrong concentration, they crystallize. Those crystals are what we call calcium oxalate kidney stones, the most common type of kidney stone by far, affecting roughly 80% of all stone cases. But the stone itself isn't the whole story. That's just the acute, painful event that gets you to the emergency room. The deeper, quieter damage comes from what's happening before the stone ever forms. Oxalate crystals, even microscopic ones, deposit in the kidney tissue itself. They cause local inflammation. They trigger scarring. They damage the tubules, the tiny passages inside the kidney where filtration actually happens. Over time, this contributes to something called oxalate nephropathy, a pattern of progressive kidney damage that looks, in lab results, like unexplained, slow kidney decline. And who is eating the most high oxalate foods right now? Health-conscious older adults, because the foods highest in oxalate are the ones constantly promoted as superfoods. Spinach, the single highest oxalate food most people eat regularly. 1 cup of cooked spinach contains more oxalate than most people should consume in a full day. Almonds and almond products. Almond milk, almond flour, almond butter. Almond. These have become pantry staples, and they are exceptionally high in oxalate. Beets. Raw, roasted, juiced. Beloved by the health community, extremely high in oxalate. Sweet potatoes. Swiss chard, rhubarb, dark chocolate and cocoa powder, instant oatmeal made from certain varieties. I'm not here to tell you these foods are poison in every situation. For a person with healthy kidneys, a varied diet, and proper hydration, they can be part of a healthy eating pattern. But for older adults, especially those with any history of kidney stones, anyone over 60 with reduced kidney function, or anyone who has been eating large daily servings of these foods for years, the cumulative oxalate load may be doing serious harm that no one has connected to their kidney numbers. And here's the part that genuinely troubles me as a preventive medicine physician. These people went looking for health. They read the articles, they watched the videos, they bought the organic spinach, and the almond milk, and the dark chocolate. They were trying. And no one told them that for their specific situation, some of those choices were working against them. So, what do? I told you early on that my goal isn't to scare you, it's to arm you. So, let me give you the practical tools to fight back against all 4 of these threats, starting with the oxalate issue. Step 1. Variety over volume. The single most powerful change you can make with high oxalate foods is to rotate them rather than eat them every day. A spinach smoothie 7 days a week is a very different thing from spinach twice a week. Swap it out. Kale is significantly lower in oxalate. Arugula, romaine, cabbage, great alternatives. You don't have to give up spinach. You have to stop letting it be the only green in your life. Step 2. Always pair high oxalate foods with calcium. This is critical, and almost nobody talks about it. When you eat calcium-rich food at the same meal as high oxalate food, the calcium binds to the oxalate in your gut before it ever gets absorbed into your bloodstream. It leaves in your stool, not your kidneys. This is why the old advice to avoid dairy if you have kidney stones was actually backwards. Eat your spinach salad with some cheese or a glass of milk. Eat your dark chocolate with a small serving of yogurt. Timing and pairing matter enormously. Step 3. Hydrate aggressively. Water dilutes urinary oxalate. It keeps the concentration low enough that crystals are less likely to form. Aim for urine that is pale, not dark. This is your daily at-home kidney health test, and it costs nothing. Step 4. Get your kidney function tested. If you're over 55 and you don't know your GFR, glomerular filtration rate, and your urine albumin level, that's your assignment this month. These are routine blood and urine tests. They give you a baseline. They tell you where your kidneys actually are, not where you assume they are. Knowledge is protective in a way that no supplement or superfood can replicate. Step 5. Reconsider your supplementation. Vitamin C in very high doses, above 1,000 milligrams daily, converts to oxalate in the body. Many older adults are taking high-dose vitamin C supplements, thinking it's harmless or even beneficial. If you're taking more than 500 milligrams of vitamin C daily, talk to your doctor about your kidney function before continuing. And for the other threats we covered today, talk to your doctor before using NSAIDs regularly. Drink water before you feel thirsty. And if you're using protein supplements, know your amounts and know your kidney numbers first. Here's what I want you to take away from today. Your kidneys are working for you right now. Every second you've been watching this video, they've been filtering, balancing, protecting. They've been doing it for 60, 70, maybe 80 years without asking for a single thing in return. What we owe them is awareness. We owe them the basic understanding of what helps them and what harms them. Because the threats we talked about today, the trusted pill taken too often, the dehydration you don't feel, the protein excess, and the oxalate hiding behind the health halo, none of them are inevitable. None of them are beyond your control. You can rotate your vegetables. You can pair your foods more wisely. You can drink an extra glass of water in the morning. You can ask your doctor for a simple blood test. These are not dramatic changes, but they are the kind of changes that compound over months and years into something extraordinary. A body that stays functional, independent, and full of life into its 70s, 80s, and beyond. That's what preventive medicine is about, not waiting for the crisis, choosing to act before it arrives. Now, I want to hear from you. Here,